Honestly, my first instinct was, okay, do I have 6 months? What is it? Like, what? And my first thought was my kids, 9, 11, and 13 at the time. So, obviously I go into like, oh my gosh, a 9-year-old losing their mom, like that's, how do they cope like with that, So that was really honestly my first thought was, how's this going to affect my kids? Are they going to be okay in adulthood if I only have 6 months to live? Like one of those things in the movies, like, oh, I'm not feeling good. And all of a sudden it's like, oh, you got cancer. My middle daughter, she's a gymnast. We were at one of her meets over the weekend. I just start kind of like, I'm not feeling great. I have some lower back pain. And my family is kidney stones run in my family a lot. So I was like, oh, it's my time. My twin had kidney stones a couple times. One of my brothers had. My dad had multiple like kidney issues. So that was my first instinct was like, oh, having a kidney stone. Went to urgent care and, similar thing. Like I was like, I think it's kidney stones. They, did some urine stuff. That we think is probably it. So following day, a Monday, I saw my PCP. Same conversation pretty much, right? Like everybody thought it was kidney stones. And she's like, if you wanted to do like a CT just to see if, how many are in there, when they're going to pass, that whole thing. I was like, sure, let's do that, so you can, figure this out. 2 days later, I had the CT in the morning. And then by lunchtime, I got a call from my PCP. And she was like, hey, can you sit down? And I was like, oh, okay. Just like the your gut drop type thing. So I sat down and she was like, I need you to go to the ER. I'm like, what? And then just a bunch of medical jargon thrown at me, right? So it's like, what? So I think I remember at one point being like, okay, so did you just say I have cancer in my stomach? And she's like, yeah, just go to the ER. I'm like, okay. So obviously panic starts to set in a little bit, right? Like ER, like in my mind, I'm like, okay, it's serious. Clearly, if I'm going to the ER, like it's probably pretty bad. My family has quite a long history of cancer in it. So obviously like a lot of things triggering and a lot of things like going through my brain. And then also, and obviously the panic of going to the ER, called my husband and said, hey, so, trying to as calmly as possible, let him know what was going on. Obviously at this point, my kids are getting home from school. So like, I don't want my kids to panic. Don't want you to panic. Like, let's just try to keep it as chill as we can. And then I called my mom again. So my mom is currently also going through cancer treatment and has been, her journey has been much longer than mine. And unfortunately, so I was at the ER, they ran some tests. I was very, very fortunate. Dr. Graff, actually one of her PAs, came down and, 42-year-old with symptoms of, lymphoma and CT scan, all that. So she came down, she kind of talked me through, like all the medical jargon. I was like, I don't even know what this word means, all the stuff. Was reassuring. And then, Dr. Graff was amazing. Like right away, I went to the ER. I stayed overnight. She got me admitted into the hospital. The next day I had a biopsy. I met her that day and she was that night came in, no BS, very reassuring.
And when I met Meg, I walked into she was in the hospital. I walked into her hospital room and I treated her like my friend. And I was like, okay, I realize this is going on, but you're a mom and you're busy and you're young and I'm not keeping you in the hospital. And you're going to be, first of all, you're going to be okay. The staging of lymphoma is very different than the staging of like pancreatic cancer. So saying to my patient, you have stage 4 lymphoma, that just has to do where the lymph nodes are, right? It doesn't mean what stage 4 pancreatic cancer. But the minute a patient hears stage 4, their whole body composition changes.
Like that was honestly reassuring. That was like, if I could use one word, like it was just she came in, it was very reassuring. There was no it was just, hey, this is what we're gonna do. Don't know even what's we don't know what what kind of cancer, like what if you even have cancer. Like we're gonna take it kind of one step at a time. And I think, for me, like she said, I was in the ER. They put me on like the cancer floor. So I was like, and I even had like nurses, wait, are you the patient? So it's like, because they weren't expecting somebody younger. And, so like you get that already and you're like, oh, and then it's just the whole situation, right? Like the hospital, everything happening so fast. So for her to come in to a complete stranger and just, like I said, be just reassuring, just keep it simple, right? Like not try to complicate it more than it already, like because emotions already are complicated in the situation. So the way she described it, she just came in and laid out options. But I do distinctly remember being like her using the words like, all these are good options. Like I wouldn't tell you that to do this or that, like they're all good options for you. They will all be good for you no matter what you choose. And so for me, again, it's like the reassuring thing, right? Like she was reassuring in that she's not recommending a treatment that she doesn't believe in. So that to me is like, okay, how can you not trust her and her, advice on that? And then, I obviously, my mom had gone through clinical trials. So the clinical trial for me was like a no-brainer. For me anyway, specifically, just, why wouldn't I want the best possible treatment that's out there? And also too, I think on the clinical trial side, it's like, you can't help anything improve if we're not willing to like help the science, help the medicine, right? And help others, so if I can do that, I mean, why wouldn't I try to help others, in this situation too? Like how she described it as like, I think of it as like it's like supercharge you. Like, okay, you're going to give me the juice to supercharge my own cells and so I can fight this, right? Like, so yeah, but she just simplified it. So it's like understandable, right? It's not overwhelming with, medical terminology and stuff. So.
And this is how I described it to Meg. I'm like, think about it like a matchmaker, okay? And you're bringing your healthy T cells, so your healthy lymphocytes, together with the cancerous B cells causing the lymphoma. And if it's a perfect match, fireworks happen. And those fireworks are basically the proteins that are released by the healthy cell to go kill the bad lymphoma cell. So you are using your own immune system. So it's chemo-free. You are literally enhancing your own immune system to fight the lymphoma.
My husband came to the first couple of appointments before I like signed all the clinical trial paperwork so he could just kind of hear it. I obviously any questions, I'm a big question person. So I kind of had all the questions already, like a little notebook, and I have all the questions. So like trying to process everybody's opinion and then also figure out what's best for me, all the medical jargon. I mean, it's just, so it was more like just information overload. And yeah, I would say like probably 4 to 5 months, I think, is when it kind of like, I just remember being like in the shower and I was like tired and exhausted. And we had, I went down the rabbit hole, the health rabbit hole, right? Because up until this point in my life, I would have considered myself a fairly pretty healthy person. I never had really any health issues ever. I'd only been in the hospital when I had delivered children. So it was like, it was honestly like a crash education course in medical health and all of it. And it's just a lot of information to download and then to try to also like process what's right for me, what's not, like, am I doing the right thing? Am I not? Like you question everything. So the first 6 months of the trial was kind of like your standard protocol, like standard treatment. So it was once a week I was going in and getting the immunotherapy, and I would say typically, it was probably like a 6-hour at least day usually. So, by the time they administer the Benadryl and the steroid, they put that in, and they have to do some saline. There's certain protocols, obviously, they have to follow with clinical trial that are a little more strict than your typical standard of care treatment. Yeah, it was usually, like I'd said, probably 4 hours by the time it started to the time it was done. For whatever reason, I think the shower is like it's like the release like stage for me, right? Like it's your only moment of quiet. The kids aren't in there. The husband's, like it's so, I don't know what it is. It's just, that's the moment where it was like, you just catch your breath. You catch your like, like that relief moment, and then it all comes out. I think mostly it was overwhelmed, was the feeling I was probably feeling the most, was just overwhelmed, and needing maybe other people to step up and take over, because I think I'm always the one to, so it was the just like, it's okay to not be the strong one all the time, and it's okay to let people care for you, and it's okay to, it's okay to cry. It's okay to show weakness. It's okay. Like all that's I think we had they called me. So we had calls and I was charting everything, right? Like in a clinical trial, like I'd chart everything, my temperature, all of it, like every 3 hours basically. So
it's a commitment. And so you're really trying to explain like, hey, we're going to monitor you. Don't be scared when we're calling you every 6 hours, but so it's a fine balance, but in a sense, it's probably almost overkill sometimes, but it's also better to be safe than sorry.
There's also like, I remember going and getting blood draws too. Like they're checking your levels constantly. So they have all like the safeguards in place. So it really doesn't feel scary in my opinion. I mean, everybody has different opinions on it, but yeah, I think because they have all the safeguards in place and like I said, they're just constantly checking on you. And they're very, I mean, they're strict, like about, like, I remember a couple times, like, oh, my blood pressure was really, I run lows, but my blood pressure was running low. And they were like, get your butt in here. Like, so they're very, like she said, she has an amazing team that, they call it like 1 a.m. maybe is a check-in and 4 a.m, so, and they're not going to let things slide if you're kind of like on, the cusp of something.
About 49% of patients will experience grade 1 or grade 2, and majority of those being grade 1. Okay. So what does it look like? So for other patients that might have CRS, I will say for the most part with our lymphoma patients, most of the time, they don't even have to come in. They really don't have to even come into the clinic. So they'll have a temperature. Okay. So you'll be on your monitoring calls and they'll have a temperature of 101, but all their other vitals are stable. And so what we'll do is we'll tell them, okay, take 1,000 milligrams of Tylenol and we're going to call you back in an hour. Okay. Now, if we make that call back, if the temperature hasn't quite broke, or if maybe their blood pressure is a little soft, not low, but just trending down a little bit lower than their baseline, but they're still feeling fine. One guy was out gardening while all this was going on. Then we'll have them take their steroids. We call it the pill in the pocket. We'll have them take their steroids. And then again, we'll call back an hour later. And then in most cases, it's gone. You've broken, you have broken the cycle and you've, kind of put out the fire of the immune system and they're back to normal. Now, if a patient were to have, that's a grade 1, right? You just have a fever. That's usually the hallmark, the presenting symptom. If a patient were to say have grade 2 CRS, which we do see, but fortunately not a lot with our lymphoma patients. She was a rock star. She had other side effects, but no, she did not have any. She had no cytokine release syndrome. And I will say that really is a test to this regimen. The way the dosing schedule is of the drug within this regimen and the fact that it's paired with other drugs decreases that risk of CRS to very low numbers compared to when we use the drug alone or when we use it in, say, like diffuse large B-cell lymphoma, which is a more aggressive form of lymphoma. And I will say that every single patient that we have treated exclusively outpatient, not one patient has had to be admitted. We've managed them all outpatient the entire time. Not to say they didn't have low-grade CRS, but they never had to be admitted. They were always able to go home.
The way she explains things, she simplifies them and reassures, so it doesn't seem as intense or as like scary as it is. There's a lot of bad symptoms you can have when you're getting cancer treatment. Like, there's tons. So not saying that CRS and ICANS isn't really severe symptoms, but I think it's just like in the gamut of symptoms when you're going through cancer treatment, right? Like there's so many. So I don't really remember feeling like nervous per se about getting the CRS. And again, because I think we had the check-ins. Like I was doing my blood pressure and my temperature.
Even whether it's a trial or standard of care, we're doing scans after a few treatments. If everything is good, we're continuing on. We're not just going to close our eyes and throw it out there and let it roll, right? We're keeping a really close eye on things.
I went into remission fairly quickly after I started treatment. So the trial I'm on is like 2.5 years. So even like going it's like, gosh, 2 years ago seems like so long ago in my process. But so sometimes I kind of forget almost, which I know probably sounds bad, but that I'm not doing the cancer thing all the time. So people very close to me in my life that since I've been diagnosed and been in remission have actually passed away from cancer. So now I'm almost my mindset is, I don't want to use the word guilt, but a little bit like I don't understand why my journey was maybe so easy, for lack of a better word, or not as difficult as others. Why was my cancer not as aggressive as others? I mean, obviously my mom, right? Her journey has been very difficult, but so it's a weird like guilt, I feel like, that. And then on top of that, it's like, am I not doing enough? Like, I've been given obviously this chance, I'm healthy. Like, am I doing enough with my life now to like, right? Like show that there's a reason why I'm healthy. And I, like there's all that. I don't know. It's such a weird dynamic. And it's something I obviously haven't worked all the way through, right? All the emotions, and I'm sure it's going to ebb and flow. And then the other one is, I'm sure for all cancer patients, it's when's the shoe going to drop again, right? Or when's it coming, right? When's it coming back? When's it, so I honestly just, my heart like is forever changed, obviously, from going through this. I remember about a year and a half into the trial, I was like, I just don't want to talk about cancer anymore, right? Like, I don't want to it always is about cancer. It's, so then there's that too. There's that bucket of emotion. Like, life, there's more to my life than just the cancer part of it. While that's always going to be part of my life, I think, but just try not to focus or dwell on that either,